Hi, my name is Heidi Schutz, and I will be presenting my presentation on vitamin D deficiency in amateur boxers. As an introduction, what is vitamin D? It is a fat-soluble corticosteroid produced in the skin via either UVB radiation from the sun or through dietary means. Statistics have projected that over 32% of Americans are deficient in vitamin D. Studies have also shown that within the athletic population, approximately one-third of the population have low levels of vitamin D. The Institute of Medicine has recommended an RDA for vitamin D at approximately 400 to 600 international units daily. So how do we make vitamin D? As I just mentioned, it can either be made through the sun or from dietary means. Beginning to the diagram on the left with sunlight, schematically this represents the conversion that sunlight does on your skin all the way into your liver and your kidney. So basically, once the sunlight touches your skin, it's converted from the 7-dehydrocholesterol to cholecalciferol, and then gets hydroxylated twice. The first point will be in your liver, where it will be hydroxylated to 25-hydroxyvitamin D. And as that red arrow to the right indicates, this is the biologically active form of vitamin D. It's one that we measure when we do a blood draw, for instance. And then it goes and does its second hydroxylation in the kidney, leaving it to 125-dihydroxyvitamin D. And vitamin D is very important. Of course, it also helps to maintain calcium homeostasis. So if we move over to the right and obtain vitamin D from the diet, there are some foods that contain vitamin D. A lot of it is fatty fish. It was first discovered in liver cod oil, milk, sardines, egg yolks, mushrooms, and cheese, and other fortified foods. However, it's not a large part of the diet normally, and normally Americans don't get enough vitamin D through just the diet alone. So as we mentioned, the cutaneous synthesis is made via UVB exposure. And chemically, vitamin D exists as either vitamin D2 or vitamin D3. So D2 is known as ergocalciferol, and then vitamin D3 is known as cholecalciferol. So why is vitamin D important? Why do we care? Vitamin D really has many roles in our body. It attaches to something called a vitamin D receptor, or VDR, which our body tissue has plenty of them. It has a role in the immune system and helping with immunity, of course in the musculoskeletal system and helping our muscles, even in the cardiovascular and our respiratory system. Vitamin D helps maintain a lot of homeostasis in all of these areas. As far as dosages are concerned, again, the National Institute of Health has recommended also an RDA for those over 18 years of age to be a minimum of at least 600, and then for those over age 70, at least 800 on a daily basis. Within the athletic community, research has shown that peak athletic performance occurs when vitamin D levels approach typically 50 nanograms per milliliter, and these are during the summertime. When assessing vitamin D status, again, we measure it through that hydroxylation process in the liver, and those levels are known as the 25-hydroxy-D levels. So that's the concentration that we would measure if we wanted to know somebody's status. Again, experts report a value at least 40 nanograms per milliliter or greater. And there is something called the minimum erythemal dose, which basically is the amount of time it takes one's skin to turn a little pink color, or a little erythematous, which is a medical term for stating redness on the skin. So the MED is approximately equivalent to 20,000 international units of vitamin D. So as you can see, obtaining vitamin D from the sunlight has quite a significant impact on how much vitamin D you can actually make. So how does one become deficient in vitamin D? There's several factors that can contribute to this. One is probably the most obvious, is just inadequate sun exposure, especially within the athletic community. A lot of athletes train indoors or are just simply not getting enough sun. Depending on where you live, latitude can influence this as well, which I'll get into in the next slide. Sunscreen with just an SPF of 30 can reduce vitamin D synthesis by as much as 95%, which is pretty significant. Skin pigmentation is another factor. African Americans are known to need at least 10 times more amount of sun exposure than, for instance, a Caucasian in terms of making vitamin D cutaneously or through your skin. There's malabsorption issues, so those suffering from hereditary disorders can certainly impact how much vitamin D you'll be getting. Those that are obese, those having a BMI over 30 are at risk for deficiency, as well as a lack of fortified vitamin D in your diet, so just not adequate dietary intake. And also medications. Certain medications have known to cause deficiency or at least contribute to it, such as anticonvulsants. So again, other considerations with vitamin D is hitting the hammer hard on this is sunlight definitely is one of the best ways to obtain vitamin D and can last 2 times longer in circulation if you compare it to the vitamin D that you get from your diet. Zenith angle is another contributing factor, which basically is highest during the summertime, and one makes more vitamin D compared to other seasons, so there is a seasonality to it. The peak hours to get this vitamin D would be from 10 a.m. to 3 p.m. And those living above a 32-degree north latitude, which is represented here by this red line, or it's also known as the 37 parallel, which is basically the intersection of that latitude and longitude. But if you see the sun there designating San Diego, this is where the study that I will be conducting will be taking place as we make our way to the research question. But those basically in the shaded area represent populations more at risk during winter months. So vitamin D and athletic performance, it's known to have impacted everything from muscle strength to recovery, and where my focus will be for this presentation, its relationship to explosive power. So explosive power is a very important physical attribute for boxing, and this is what we will be exploring in reference to vitamin D. This finally takes us to the research question, which is, does increasing boxers' daily training time outdoors by 20 minutes in 25-hydroxy-D deficient, defined as less than 20 nanograms per milliliter, lead to an increase in explosive power as measured by the Vertec vertical jump measurement system? In reviewing the literature, again, boxing has known to, in most sports, upper and lower limb muscular power are positively correlated in boxers. So that explosive power that we intend to measure through the Vertec measurement system is going to be shining some light to this area. Studies have shown that vitamin T supplementation, which has been more widely studied compared to cutaneous synthesis or dietary means, does have significant improvements in vertical jump height. Majority of the literature does study vitamin D within the athletic population more so in terms of supplementation than it does in reference to getting vitamin D through sunlight. In terms of muscle strength, so multiple studies have also evaluated the physiological effects of vitamin D on muscle function. Vitamin D does increase muscular strength through augmentation of type 2 muscle fibers, and type 2 muscle fibers are known to have a strong correlation with physical performance and muscular power, of course. Sun lamps have modulated the same effects in research and have been shown to increase vitamin D as well. So vitamin T levels have been low in the athletic population, as reported by some studies, due to possibly a higher metabolic rate, or perhaps even just the amount of time these athletes are spending training indoors, where they're living. As we mentioned, all these factors such as latitude can contribute to risk for deficiency. This here is a table just comparing a few different sporting disciplines. The top area is shown by the darker green arrow saying sunny months. That there is just showing you that there's a correlation between the amount of time that these athletes are outdoors and what their serum vitamin D concentration levels are. So if you compare that to the sporting disciplines below them in the winter months, they're designated by that arrow at the bottom. You can see that, clearly more time spent outdoors training, more vitamin D found in the blood. So that's essentially what that's showing you. So the quantitative analysis portion of this study will include using the Vertec vertical jump system, as I mentioned before, and here's a picture of that. So Essentially, we'll be taking the best of 3 jumps. The athlete will start in a squat position and will jump up as high as they can touch the top there on 3 different occasions, with the third, or I should say with the best score being taken out of the 3. And again, this is to assess its relationship to explosive power. The bod pod there is an air displacement fitness assessment device, and that will measure certain characteristics of the boxer's body fat, lean mass, fat-free mass, so certain things in that area. It's pretty accurate. It's highly recommended for leaner athletes. If you compare it to, for instance, like the DEXA scan, the bod pod has been shown to be more so the gold standard, as it's the most consistent and it's more affordable. And then lastly, we have the blood draws there at the bottom. So in terms of the data analysis, so G-Power software will allow us to compute an a priori power analysis, which we will have a power analysis for a significance of at least 80% and an alpha of 0.05. Using Pearson correlations, we will be assessing the serum 25-hydroxy-D levels in sun exposure, as well as sun exposure and the dietary vitamin D from questionnaires, from the pre-validated questionnaires. Paired t-tests will be used to assess changes in serum vitamin D concentrations pre to post intervention, and then an ANOVA will be done to test for differences in vertical jumps. Of course, informed consent and conforming to all standards as stated by the Declaration of Helsinki will be utilized, and ethical guidelines will certainly be followed according to those stated in the Belmont report. So discussing the strengths and limitations of the study, certain strengths will include the ability that it will contribute to research in an understudied population, and that is boxing. There's only been one study that was done in Ireland that has assessed vitamin D in boxers, and they were elite boxers and not amateurs, so this will be a great contribution to literature on that end. The fact that we are using standardized data collection tools, such as those pre-validated questionnaires, will also be a strength of this study. Continued treatment for participants after remaining vitamin D deficient is also another strength of this study. So at baseline compared to post-study, if those boxers are still left being deficient, we will provide proper supplementation depending on how deficient they are, and they will be allowed a visit with a primary care physician to ensure proper follow-up and to ensure completion of their treatment. Also, this can potentially lead to a protocol that can help guide athletes and their trainers to possibly get, if there is a correlation of explosive power and vitamin D, another route that they can take versus doing supplementation. So this is something that can be explored. Some limitations of the study do include the fact that we did not directly measure UVB absorption, which would have been very helpful. This is kind of measured by, or known as skin reflectance, so future studies can include this. San Diego is a polluted city, such as Los Angeles. Both of those southern cities have quite a bit of air pollution, so this is something that perhaps we can control for in the future by doing more accurate measurements of maybe when and what time of the year to conduct the study. Self-reported intakes for questionnaires could also be problematic, so inaccurate reporting as well as different variability in skin pigmentation. Future research can be guided by, again, just having a more accurate measurement of that UVB absorption, perhaps dosimeter badges, maybe measuring weight classes or different divisions of boxing, such as featherweight versus lightweight versus heavyweight, could be something, because BMI is certainly something that can affect vitamin D synthesis. And lastly, just exploring other physical demands of boxing. We investigated the explosive power component. There's many other attributes, anaerobic or anaerobic, cardiovascular, many components of training that could also be explored. And here is a list of my references. Thank you so much for your time. I appreciate it, and have a lovely evening.